Hi, I'm Aspen. I'm studying pre-med at University of Arizona. I'm a HOSA alumni and I'm currently working as a phlebotomist down in the ER at Intermountain Health. Okay, so for this skill, the routine ETS venipuncture, you may, depending on the situation, get a combination of a real life patient and a mannequin, so it kind of just depends. But first you'll be given the review. You'll have to review the lab request, so the lab order, and you'll approach and greet the patient, tell them who you are and why you're here, and then you'll obtain their info by asking them to give you their name and date of birth, and then ask them to spell their first and last name. And then you'll match the patient info which you're given on the lab order with what they said to make sure that you have the right patient. And then you'll explain your procedure and get the consent, and then you'll verify the collection requirement and talk with the patient about any potential problems, such as if there's an arm that they can't use for a certain reason. And then that's when you'll start the actual poke. Okay, so now that we've identified the patient and dealt with all their paperwork, it's time to start. So you'll wash and glove, and then you'll grab your tourniquet, and you'll make sure that the position of their arm is downward, especially if they're sitting. Just make sure it's at a nice angle. And then you'll apply the tourniquet, which was explained in another video. Making sure that both of the ends of the tourniquet are up so it doesn't contaminate anything. And you'll instruct the patient to clench a fist, which during this skill they may or may not be able to do depending on your patient. And then you'll feel for the vein, which on this one you can see it pretty nicely, but if not, it should feel sort of bouncy. And then you'll identify landmarks so that you can find it later and take off the tourniquet. That's it. Okay, now that we've found our vein, we'll clean it using pressure and up and down movements. Clean the whole area. And then we'll let it air dry. And in the meantime, we'll grab our needle. And depending on the needle that you use, you'll have to put it together. This one is already put together, but if it wasn't, this piece and this piece would be separate, and normally you would just twist them together. So while we do that, as soon as this is dry, we'll say that it is, you'll reapply the tourniquet, ensuring not to touch our area with anything so that it doesn't get contaminated. Now that the tourniquet is back on, we'll grab our needle, and you'll warn the patient of the incoming stick. You'll uncap it, and you'll make sure that the bevel is up, which is the hole in the needle. And then you'll make sure the skin is taut by holding about 2 inches below it. And then you'll stick. And then you'll add a tube in the right order. And you'll make sure with your forefinger and your middle finger to hold on to it while you push the tube in with your thumb. And then each tube has a vacuum in it, which will pull the water in. And you can take it out as soon as the vacuum stops, which it looks like it did. And then normally you would do others, but you'll take the tourniquet off and tell them to unclench their fist and grab a piece of gauze. And while you remove the needle, place the gauze over it and cap the needle. And then you'll tell the patient to add pressure to the site. And then you can add the wrap. Normally you could open this while the patient holds pressure, depending on who it is, and if they're able to help you. But if not, then you can wrap it. Make sure it's tight with pressure because that will help it stop bleeding quicker. So normally you would dispose of this immediately after taking it out, but we'll just put it in our sharps container, or a container that's able to hold sharps and or liquids. And then you will label your tubes in front of the patient so that they know that they're getting it, which will be like an actual label, but for this case it's just like a sticker. And then you can show them, you can ask them their identifiers again, and then you can thank the patient, and then you're good to go.